one of the solutions that Rwanda took to make sure that the burden that we are seeing in the hospitals to get some of the budgeted funds that they are putting to really allow drugs to be available need to be facilitated. The discussion was initiated many years ago, and as of today, we have clear policy on how this is going to be implemented, and the Minister of Health, working with the Rwanda Social Security Board and also other stakeholders, have been discussing on this, including also DGs of hospitals, but also local administrative entities, to make sure that we streamline the implementation of community insurance.
One of the efforts of AHETI is advocacy. And we are also not only working with individual governments like Rwanda, we are also working at the level of AU organizations like the CDC and the AU NEPAD, who are focused on this topic. So that, for example, when something is approved in Rwanda, which is a member of the AU, that should be approved for the rest of Africa, just as it is in the AU. So we are not only focusing on production of medicines, but also ensure that there is the requisite and right policy context, including regulatory mechanisms that are harmonized. Yeah? So that what we're thinking about are the 1.3 billion people in Africa. You're not thinking about Rwanda alone. We are establishing the Ubuntu Health Impact Fund, which is a way of incentivizing pharmaceutical innovation and production in and for Africa. What this fund will do is that it will promise to reward those innovators and those pharmaceutical producers who are producing for Africa or are repurposing their medicines to have an impact on African disease and bring down the disease burden. That's why we have the word impact. So we sort of give it to support them to ramp up production.
We worked with African governments and other World Trade Organization members to have a waiver of some of those rules at the request of the African delegations in order to be able to facilitate production of COVID vaccines in Africa. I think part of this initiative that is being launched today recognizes that there are a number of different challenges. I think they talked about some of the policy challenges, financing challenges, logistics. I think we need a range of solutions to be able to address the problem. And what we did at the World Trade Organization is part of that broader conversation.